Echoing what I had said in earlier videos, there's a whole lot of stuff that's really not medicine that the hospitalists are expected to manage. One thing that's kind of shocking to me is that internal medicine, I feel, is kind of like the default service. At least in our institution, we don't reject any cases. So what this means is when other services don't have anything to offer a patient, medicine has to just take them. So sometimes people just have social issues. Very frankly, everything with their hospitalization is done, or there isn't anything else that we're changing, but they don't have a safe place to go, so we kind of still have to see them every day. They are still our patient. Placement issues, insurance issues, psychiatric issues. If a patient is like a psych patient, but medically there isn't anything else that we're doing, but they're just looking for a safe place for this patient, then we still have to see them. So internal medicine sometimes is kind of the default service. And that can be a situation where you're not used to the fullest of your ability and training. At this point, I just realized that's just part of the job. It's okay. Like, if that's what's needed to help the patient, that's fine. And since COVID, this seems to have increased. I think a lot of people scratch their heads as to why, but I have a theory. And here's my theory. You ready? My theory is that COVID has significantly changed the health and medical landscape. It has isolated people a little bit more. People are kind of cut off from their supportive networks. I think this is a big deal because elders who used to be more engaged with their families or friends, their functional status has declined because they're not as engaged in the community, they're not as cognitively active, and that has led to, I think, more morbidity, honestly. And people have less of a support structure that they used to. And so everyone is using the safety net more. And the ultimate safety net is the emergency room. And the emergency room's safety net is the hospital. So all our volumes are going up, and from what I understand, all the volumes are going up across the country. Another role that I found myself being that I didn't expect was being kind of like the interpreter or the guide to a patient's hospitalization. If somebody has kind of a complex disease process or a complex course, chances are they're probably going to have a couple specialists on board, and sometimes the specialists just focus on their area of specialty, right? So the hospitalist can find themselves as the interpreter or the guide. Somebody needs to paint the entire picture for the patient, and a lot of times that's what we have to do. So I find myself in a medical interpreter kind of guide role. One thing is for sure though, when you take the time to explain these things to patients, they are very, very, very grateful, and actually it makes the job easier for the nurses and everybody else. So take the time to explain to the patient, and I've said this in earlier videos, explain, here's what's going on, here are the specialists that are going to see you, here's what they're managing, here's what to anticipate as best as we know it right now. If you just take a couple minutes to explain that, the hospitalization will go a lot better. I seem to remember hearing that one time if your train of thought is interrupted, that it takes like half a minute to a minute to get back to where you were. It's shocking how frequently we get interrupted in a day. We use Epic and we have the chat feature, but the Epic chat feature is great and horrible at the same time. The pop-ups come relentlessly, and the amount of interruption of your concentration it's impossible to describe, but it's really, really difficult, and it's kind of a major thing. What I would like to see happen, and if there's some way I could tag Epic in here, I'll try and do it. But here's a feature request. I call on Epic to try and help the clinicians preserve our concentration, and here's my suggestion. If we could set a interval, like maybe 15 minutes or 30 minutes, where all text would be silenced, and then we would only get a batch of Epic chats like every 30 minutes. Unless the nurse or whoever wants to put the communication in marked as like critical or urgent, and then it would come right through. But a lot of times I'll get interrupted with a chat from the nurse saying something that can wait. An example is if I haven't seen the patient yet that day and it's the middle of the morning, a chat will come from the nurse saying, "Hey, patient would like to see you today." And so I remind the nurse, "Yeah, this patient's mine, so I'm definitely going to see them at least once a day." Okay, so that chat didn't need to happen, but it broke my concentration, okay? So I understand the nurse is responding to whatever the patient tells him or her, and so they want to pass it on. They go, "I'll pass on the message," okay? But a message like that, it can wait for half an hour, you know? So my feature request to Epic is give us an opportunity to batch the chats, and they would come through every half hour at the most, okay? Because obviously you can't batch a chat for every like 2 or 3 hours. But maybe every 30 minutes I would see 10 chats come through. But if something was absolutely critical, then a nurse could check this as critical and it would go through faster. That would go a long way to helping maintain the concentration that's really needed for our job. So anything that could be done to minimize the interruptions would really help. Anyway, that being said, the previous videos with these comparisons should be clear by now that the job is far from perfect, but there are definitely advantages to it, and I could see myself doing this for the rest of my career. It has enough to keep me satisfied and interested, and I do feel like I help people in a meaningful way. I'm also still very happy with my choice of being a PA in general, so for now, this is what I do. And I think if you're the right person, it's a career that you can do for a good long while. Please let me know if you have any questions.